Assalamu alaikum. So in this video, we'll be talking about the C6 nerve root examination, how to test the C6 nerve root, what are the examination that you need to do, and what will happen if a patient has a lesion within the C6 nerve root. I am Mohammed Raz, and this is your knowledge platform about the brain, spine, and beyond. So if we look here at this picture, as we said in our previous video about the C5 nerve root, if you haven't watched that video, please go through the link above to watch the examination of the C5 nerve root. So in this one, as you can see, we have the three parts that we need to examine, which includes the motor examination, the reflex or reflexes, and the sensory examination. And as I mentioned before, there is an overlap between the nerve supply or nerve root supply to some of the motor or sensory or reflexes supply. So you have to keep in mind that it's very rarely to find one part of those examination that's purely supplied with one nerve root. So in terms of the best thing to test the C6 nerve root is through the motor supply. The first one is the extension of the rest, and that's supplied by the extensor carpi radialis muscle, and this is supplied through the radial nerve. But also you have to keep in mind that this also can be supplied by the C7 nerve root. So that's the rest extension. So you ask the patient to extend the rest and you try to oppose that movement again and see how strong is that movement. If the patient has a pure or isolated C6 nerve root injury, then there will be an ulnar deviation of the rest as the patient is trying to do the rest extension. The other muscle that can be tested is basically the brachioradialis muscle, and the brachioradialis muscle is basically helps with the elbow flexion. The C6 nerve root also contributes to the biceps nerve supply, biceps muscle supply, which we mentioned in the C5 nerve root, but we keep it under the C5 nerve root more than the C6. So again, with the elbow flexion can be part of C6 nerve root examination, but to purely test the C6 nerve root, then you do the brachioradialis muscle. And the difference here is that the patient has the arm is pronated. So the arm is inward or pronated, and you ask the patient to try to flex the arm into this pronated position so that you can test the brachioradialis muscle. Then moving to the reflexes we have here the brachioradialis reflex. But again, given the overlap, the C6 nerve root also contributes to the biceps reflex. But to purely test the C6 nerve root, the only reflex that's supplied by the C6 or supplied purely by C6 is the brachioradialis reflex. And similarly, again, in a pronated arm, you ask the patient to keep the arm in that way, keep it relaxed, and you use your hammer to test around the tendon of the brachioradialis here, and then you will see the flicker or the flexion of the arm in that position. And then going to the sensory examination. The sensory examination, basically the C6 nerve root supply, as you can see in this picture, the lateral part of the forearm, which is around here, and then also supplies the thumb and the index finger and half of the middle finger. So if you can see here in the top picture, that's the front, and in the lower picture, that's the back side of the supply. So to purely, the best way or the best area to test is basically the lateral part of the forearm, or basically towards the thumb, which is more accurate, so you can test it here. Some people test patients in that way, so you use their pinprick and they kind of go all over the place. You have to be very specific, and you have to, because the sensory examination is very confusing for the patient, so you have to try to make it concise, and also to make it easier for yourself, you have to specify points where you are going to test. So as we said previously, the C5 nerve root examination is just at the tip of the shoulder, like around the deltoid area, so you're not kind of pinpricking all over the place. And also for the C6, it's better if you use kind of that area around the thumb, which is more accurate for the C6. So to summarize, basically motor examination, including the rest extension and flexion of a pronated arm. In terms of the reflex, we have the brachioradialis reflex. You can also test the biceps reflex. And the sensory examination is the area of the lateral side of the forearm plus the thumb, where you can test the sensation. I hope you enjoyed this video. We'll keep running those series of videos that we will cover all the examination of the nerve roots from C5 all the way downward. Please stay tuned for the next one. Thank you.